I think it's really important, though, for us to not just think about this and talk about this from a death and capacity standpoint. And I'm as guilty of that as anybody else. We tend to focus so much on hospital capacity, so much on the number of deaths, and we don't always talk about the folks who have it and what that experience is like. And I spoke at our last one of these briefings about how I feel like one of the challenges that we face in people taking this seriously in our community, in overcoming this pandemic fatigue that's been referenced, is that a lot of people don't know somebody personally who's had it still. It's still a new virus. You see examples, very thankfully, where the governor gets it and he's a healthy guy, he recovers quickly. You see the president get it, goes away, gets the best healthcare treatment that the world has to offer, recovers, comes back. Those are not necessarily typical situations that a typical Tulsan is going to get access to, though. And at the city of Tulsa, we're one of the largest employers here in our community. And over the last several weeks, I've had the opportunity to hear about the experience of our employees who have contracted this virus and what it's like for them and their families. You know, right now, just today, in quarantine, we have 46 non-sworn employees quarantined. We have 62 firefighters quarantined and 74 police officers. Let me tell you two stories from the last couple of weeks. We had one city employee who contracted COVID-19, had just shy of 106-degree fever, and got turned away from 2 hospitals because his respiratory function wasn't bad enough. Was given fluids and sent home with a 106-degree fever that was sustained. Another employee who was very ill with COVID-19 and could not get admitted to a hospital until he developed pneumonia. So that's the threshold that our community is facing right now as far as the capacity for our hospitals to be able to treat people. Your respiratory function has to be in danger of collapse. Less than that, discomfort, agony, you have to go home and treat it yourself.